Hello, dear students and esteemed learners. Welcome. Welcome to my course on Sociology of Health. Now, this is the beginning of the 8th week of our course, and the theme for this course is Health Policies in India. So, policies are very important. Policies are actually the vision documents, the broader guidelines for the nation state, and these suggest the plan of action for the specific period, and along with that it also talk about the kind of realities in which those policies are actually formulated. So in India, by now we are having three national health policies, and we'll talk about all these three national health policies, and along with that we will also try to understand the specific background in which those policies actually emerged, because the background say a lot about the outcome of the policy and the goals and objectives of those policies. So as a student of sociology, we will be interested not only in the provisions of the policies, but also the way the problems were existing or the issues were there, and how did the policy document actually translated those issues into the policy, and then what kind of continuity basically existed, because the policies do exist in some sort of continuity. So normally we have some kind of plans attached with the policies, and we had the 5-year plans. So this national policy on health, or the national health policy, basically was also associated with some of the 5-year plans. However, in the past few years we have done away with the system of 5-year plans. So we will see what kind of arrangements are there when we will talk about some of the latest health policies. But as of now, we are going to talk about the National Health Policy 1983 and the Alma Ata Declaration. We have been talking about the Alma Ata Declaration in many of the previous lectures because of its focus on the target of health for all by 2000 and its focus on the primary health care. So let us go and try to understand what these are. The points that we have included in this lecture are background of the National Health Policy 1983 and the state of primary health care before the National Health Policy 1983 and the Alma Ata Declaration, and then primary health care according to Alma Ata Declaration, and finally the important provisions of the National Health Policy 1983. So understanding the background of National Health Policy 1983 will need a recapitulation of some of the important points that we have discussed in some of the previous lectures, or those points may emerge afresh also. First, that this policy was implemented in 1983 and the Alma Ata Declaration came in 1978. Then there are other important things, because we have seen that India started very important programs for vaccination and at a later stage immunization, and there was success also recorded in some of those programs, rather many of the programs. India has successfully launched the vaccination program for smallpox, and it was almost like eradicated. Then we had several disease control programs, and the problems related to malaria, tuberculosis, leprosy, blindness were up to a great extent controlled. And then there were issues like developing the health facilities and health infrastructure. Now, long back, the Bore Committee in 1946 itself has recommended the development of primary health centers and then integration of the curative and preventive aspects of health. So, the preventive aspects are basically related to the vaccination programs, and the curative aspects are basically related with this the disease control programs, or basically when we go to a hospital or a clinic when we have some kind of health issue or some disease or some problem, and then we get cured for that. So you might have read about that in some of the previous lecture. We also talked about integration of, right? So these were the issues which were already existing. Then the nutritional health issues were already getting identified, because there were problems related to infant mortality, maternal mortality, and prevalence of anemia, etc. So these were the situations which were already prevailing. Some of those were on the positive side and some of those were on the negative side. Then a brief understanding about the primary health care is also required, because we will see that how Alma Ata declaration made a difference and what kind of changes basically were suggested in the health policy. So what was existing at that point of time? As we stated, the Bore Committee had already recommended the development of primary health centers, right? Now, you need to understand the difference between primary health care and primary health center, although in short form we use the word PHC, but for the primary health centers we generally use the term PHC and small s, PHCs, and for the primary health care we use the term PHC, because primary health care is a broader concept, and primary health center in India are a specific you can say center which is performing some of the specific works which could be identified as primary health care, but not necessarily translating the larger idea behind primary health care. So we will understand this when we will see the other slides, and especially when we will see the Alma Ata declaration also. So in the trajectory of developing the primary health centers, there are 2-3 important developments. First, that Bore Committee had recommended it. Second, that after independence, way back in 1952, under the Community Development Program, there was some sort of beginning of establishment of the PHCs, that is the primary health centers. And then in 1973, an important development took place in the form that it was suggested that the trained female health workers identified as auxiliary nurse midwife or ANM, and then trained male health worker generally labeled as multi-purpose workers should find their placement at the sub-center level. So this is an important event. And then in 1977, there was another execution or implementation, and that was of the village health guide scheme. So that was also suggesting that having a health worker from within the community. Now this is basically linked with the concept of ASHA, accredited social health activist, that basically got executed under the NRHM program. So there were things which were which have been started long before also. We need to have some kind of idea about those developments also. So now we come to the Alma Ata Declaration. The International Conference on Primary Health Care held at Alma Ata, USSR in 1978 conceived the vision of health for all by 2000. Now there are two very important things here. First, that this conference is talking about health for all. All means all citizens, all people world over, irrespective of the nationality or ethnicity or class or sex or whatever divisive identity you can think of, irrespective of all these things, the goal of health for all. That was envisioned. And then along with that, there is a timeline also that this goal should be achieved by 2000. So that way, the Alma Ata Declaration is becoming very important because the world was witnessing or having some kind of health facilities for the specific groups almost from centuries. No matter to what extent those were effective, but well, at some sort of provisioning has always been there. You can say that the health issues related health issues of the elites were somehow getting addressed at the best possible level historically. However, for the first time in the history of human civilization, it was stated formally at the international level that everybody deserves good health. Of course, World Health Organization has talked about it, but the actual plan of action came for the first time at the Alma Ata Declaration. So that is why this is very important. And then there was another important thing that for achieving the goal of health for all, it was it was required that lots of infrastructure facilities should be there. However, this declaration talks about the primary health care, that this goal can be achieved through the idea of having a sound system of primary health care. And this declaration has also very comprehensively defined primary health care. So we need to talk about that. However, very briefly, we would like to talk about the declaration of the Alma Ata also, because the declaration is making use of good number of terms that we need to understand also. Just have a look. The international conference expressed the need for urgent action by all governments. So basically categorically stated that all governments need to take urgent action. Action is required, and that too very urgently and at the level of all governments. So we can understand the impact that it would have created. Then in which direction? Basically, all health and development workers and the world community to protect and promote the health of all the people of the world. Right? So it is saying that urgent action is required by the governments, then also by the health and development workers, and also by the world community. And for what? For protecting and promoting the health of all the people of the world. Then it talks about so many important things. We'll try to understand some of these. Primary health care is the key to attaining the target of health for all by 2000. Fine, we talked about this. Important point here is that it is the part of development in the spirit of social justice. So, talking about health is basically talking about development and in the spirit of social justice. So, we have a fair understanding of the term social justice, and talking about health is related to talking about social justice. And that is why I stated at the initial level that health policies are actually the social policies which do not operate like the economic policies. They have a social market, they have different principles basically. Then primary health care is an essential health care based on practical, scientifically sound and socially acceptable methods and technology. Okay? Practical but scientifically sound. These are two very important terms. I have highlighted these. Then what is very interesting here is this, that socially acceptable methods and technology, that whatever practices or interventions basically we are talking about, there should be kind of social acceptance, because if there is no social acceptance, then people will not basically execute or adopt those. And then made universally accessible to individuals and families in the community through their full participation. So, the next important thing is basically participation of people. And then what is very interesting is at a cost that the community and country can afford to maintain at every stage of their development. That means it should not be very costly. If it is going to be very costly, then the countries which are not having very good GDP or GNI, then they will not find it affordable, or the people who are not having very good income, they may not find it affordable. So when we are talking about primary health care, then one of the important constraints or one of the important requirements here are related to the cost. The cost should be affordable. Then primary health care is the first level of contact of individuals, the family and community with the national health system. So this is the first level of contact. Basically, whenever someone is in need of the healthcare services, then should be in a position to approach the national should be in a position to approach the primary health centers. Then what are the specific requirements? The declaration is also talking about the specific requirements of the primary health care, and I have mentioned these things in this slide. These are self-explanatory. We have already talked about many of these things because it is talking about a kind of integration of the promotive, preventive, curative and rehabilitative services. Then it also says that the notion of primary health care is related with the economic conditions and socio-cultural and political characteristics of the country, because then only these things could become acceptable and these things could reach to the level of the requirements of the people over there. Then it talks about basically having a very broad perspective, something that we have discussed in the public health topic, because it talks about all possible social and environmental determinants like food supply, proper nutrition, adequate supply of safe water, basic sanitation, maternal and child health care, including family planning, immunization. All these things, whatever we have discussed under the concept of public health, is being suggested. So we can say that this primary health care is basically taking care of all the needs related to public health care in such a way that these services are accessible to people at the grassroots level, and not only accessible but affordable. Then it also talks about the all other possible sectors like the agricultural sector or the other sectors in the economy. And finally, it also talks about the various kinds of health workers like the physicians, then the midwives, nursing staff, auxiliary health workers, community workers, and the traditional practitioners. That means the notion of primary health care talks about making health services available to people at the grassroots level, and these health services should be integrated and very comprehensive. Now we talk about the National Health Policy 1983, and we have already stated that one of the core thrust of having this National Health Policy was the Alma Ata Declaration, because the declaration had itself stated that all national governments should take steps in this direction. So we will quickly have a view on some of the important provisions of the health policy of 1983. The main focus of this policy was the formulation of an integrated and comprehensive approach towards future development of health services. then appropriately supported by medical education and research, with a special emphasis on PHC, that is primary health care, and related support services. So there are four specific components or targets as I have identified and highlighted them in the slide in four different colors. First is the integrated and comprehensive approach. So before having the National Health Policy 1983, we have seen that we were having the vaccination program, which was existing in isolation or separately. Then we were having the disease control programs, which were also existing separately. Then we were having the development of the some of the primary health centers and sub centers, etc. So those were existing in isolation. And then we were also having the family planning programs. And in the in the mid 1970s, basically the family planning program became very important for the government, and often the government tried to execute those plans going beyond the acceptable ways of executing those programs. So there were some kind of problems, and we all are aware of the fact that there was basically imposition of the political emergency also in the 1970s, and then there was change of the political regime also. So the point that I want to mention here is this, that family planning was one of the important focus of the government in the 1970s, but that was not executed well, and that has created huge political impact. And later on, basically this approach towards family planning was changed, and it was realized that actually family planning cannot achieve the targets of having a stable population unless we are going to reduce the infant mortality. Because if the infant mortality is having a high prevalence, then people will continue to have more number of children, because they will never have the confidence that the children that they are having will survive, right? So that is basically a very important thing, and the kind of trust in the system is required at the level of the people, and that is why the Alma Ata Declaration talked about that the provisions should be acceptable to people, because during the family planning program we have seen that if the provisions are not acceptable to people, then those may not succeed. So the next important thing here is the future development of health services. We have talked about this, that if we are going to follow these kind of provisions, then we can basically reduce the infant mortality, maternal mortality, and several other indicators of health could go in favor of the nation state. And then there are two important things, basically supported by medical education and research, because if we are going to expand the care services, then we also need good number of medical professionals and paramedical staff. Basically the manpower is required, of course the women power also. So for that a policy was required, right? And this policy has tried to fill this gap. Then the attainment of this goal requires a thorough overhaul of the existing approaches to the education and training of medical and health personnel, and the reorganization of the health services infrastructure. So basically this policy has stated that if we wish to achieve all these goals, then some kind of overhauling is required, and some kind of reorganization of the system is also required. And this policy basically is suggesting the ways by which this overhauling and reorganization is technically possible. So considering the large variety of inputs into health, it is necessary to secure, the policy says that there are important requirements. What are those important requirements? That complete integration of all plans for health and human development. Now, as we stated earlier, There were plans, there were programs, but in isolation or disconnected. This health policy is talking about integration of all plans and then following the human development approach. And then the overall national socio-economic development process. And then the another important thing is this, that all these requirements cannot be fulfilled unless we follow the guidelines for the socio-economic development processes, because without having a social development and economic development, the health goals cannot be fulfilled, right? So there are realizations which are comprehensive. Then it also talks about the pharmaceuticals, then the agriculture and food production, then rural development, education, social welfare, housing, water supply, sanitation. Everything that we were talking about when we were referring to the Alma Ata Declaration, you can find a reflection of those things in the health policy of 1983. Then it talks about the prevention of food adulteration. Yes, we all know that food adulteration is a big problem, and that is responsible for causation of good number of mortalities. So it talks about this. Then maintenance of prescribed standard in the manufacture and sale of drug. So the pharmaceuticals, the drugs, basically the medicines that we are consuming, if these are not made following the international standards, then those may create problems. So that aspect is also taken care of. Then conservation of the environment. And when all these things are basically done, then the environment should be taken care of. Then some of the other provisions, it reiterated the resolution of taking health services to community and ensuring cooperation of the community. Now, when we are talking about basically primary health care, then one of the important requirements here is this, that the community should participate in the health behavior, right? Without ensuring the participation of the community, we cannot think of achieving the goal of health for all. Then it recognizes the nutrition, prevention of food adulteration, and maintenance of quality of drugs and water supply and sanitation. Some of these points we have taken earlier also. Then it talks about the immunization program. So yes, of course, we were having an immunization program, but now this is finding place in the health policy, so that the government can plan that what other vaccines need to be included under this broader immunization program, and then what kind of interventions required for the maternal and child health services. And further, there is mention of the occupational health services, which are basically related to the health requirements of the occupational forces, or you can say that the people who are engaged in different occupations, they have some kind of vulnerability because of the specific environment that they are working. For example, the workers who are there in the mines, or those who are working in some of the hazardous industries, they are having some kind of a specific exposure. So there should be provision of taking care of the health needs of those people also. That is what is generally known as the occupational health. So they are mentioning of these things also. Then reorientation of the existing health personnel. So basically, this is very important, because earlier the health personnel were involved in specific types of work. So either it was family planning, or it was disease control, or it was vaccination type of thing, right? But now this policy is talking about integration, and so the existing health personnel should be reoriented. So we can say that there are few very important things which are coming out from the National Health Policy 1983, that it talks about a phased and time-bound program. It talks about the health volunteers, like we have the health activist program. Then it talks about a kind of referral system when people will have a kind of health services at the primary health center, and if they need some kind of specialist services, then they can go to the higher center. This is generally known as the referral system. Then a kind of integration is required among the specialty and super specialty services. So the super specialty services are generally referred as the tertiary care, and the specialty services are generally referred as the secondary care, and the normal kind of basic kind of health services are generally understood as primary care. So there should be a kind of integration and connect between the primary, secondary and tertiary forms of care and the services also. The union government incorporated many of these decisions at practical level, and it definitely strengthened the healthcare system and health outcome of the people. So before we close this lecture, we can have a look on some of the basic statistics, basically, so that we can get an idea about the achievements of this national health policy of 1983. So here you can find 3 columns for 3 important indicators: life expectancy, crude birth rate and crude death rate. Now we have figures for the years 1951, then 1981 and 2000. So 1951 figures are basically the figures which were suggested by the Bore committee, because that was the Health Survey and Development Committee, as we have already read that, and you can find the statistics are actually matching. So please do mind that these figures were basically these figures are representing the situation of the British India, right? As we discussed when we were talking about the recommendation of the Bore committee. So life expectancy in 1951 was 36.7 years. Now that reached to 54 in 1981, and then we had the first national health policy in 83, and so now by 2000 that has reached to 64.6. So we can see that from 54 to 64, this is a very good increase in the life expectancy. Then in the crude birth rate, at the time of the independence it was 40.8, it was very high. Then it was lowered up to the level of 33.9 by 1981, and then in 2000 it was 26.1. And similarly the crude death rate has also been lowered. It was 25 in 1951, and then by 1981 it came to 12.5, and then by 2000 8.7, right? So 8.7 is basically a very practical kind of statistics, a very practical kind of death rate, right, which is comparable. But before that we were having very high prevalence. And then the most important thing, that is the infant mortality rate. So at the time of independence it was very high, 146. Then it got reduced to 110 by 1981, and by 2000 it got reduced to 70. Although this is very high even now, but if you make a comparison with the previous time period, then you can get an idea that this national health policy really helped in developing good health infrastructure and in achieving the objectives which were basically identified at that point of time. So with this we came to the end of this lecture, and before we close, have a look on the think about this and activity question. So try to answer these questions. It will help you in broadening your understanding about these topics. So take care, and we will meet in the next class, and there we will talk about the second national health policy and some of the important political and economic events which happened between those two national health policy. So take care.